Welcome back to NYIT Roundtable. I'm Denise Moore. Today we're talking to some NYIT medical students who went to Ghana to offer the citizens there some much needed health care. Joining me now are medical students Angana Chaudhry and Katie Kelly, who spent a month in Ghana this past summer. I just want to thank both of you for joining us today. So first we'll start with you, Katie. Tell me a little bit about the clinic.
It was in the town of Awarabong, which is very rural. It's about an hour drive on an unpaved road from the nearest large town. And there's no electricity, no running water. So the clinic is basically a large building that actually used to be used to store cocoa yams. So it's kind of like a warehouse that they've converted. And we brought over a lot of medical supplies, so we were able to have some basic medications, have basic supplies, and able to set up a laboratory to do diagnoses.
You get there, you see the setup. What'd you think?
We got there at about 1 o'clock in the morning after 36 hours of traveling. So we were just glad to be somewhere where we could lie down and go to sleep. But when we were able to see the clinic, I was actually surprised by the quality of the building, the enthusiasm of everyone that was working at the clinic and helping us. And as soon as, if we said we needed a table, they would have people there to make it for us right away. And everyone was wonderful in helping us and being able to provide everything that we needed.
Okay, so you're talking about you get there, you go to sleep. Where do you sleep?
On the floor. We had little inch-thin mattresses on the cement floor, and it was 2 people under one mosquito net. So it was a little different than what we're used to at home, for sure.
I'm sure it sounds like it is. Okay, so Angana, tell me, was the clinic different than you expected it to be?
When we actually got to the clinic, there was nothing there. We brought all the supplies, and there were some supplies that were shipped over from a company here in the States called MedWish, and they kind of take old supplies from hospitals here and send them over to developing nations. So we went in and we kind of set everything up. I didn't really expect anything because I'd never been to a developing nation before beyond India, and where I stay in India with my family is very suburban, so nothing at all like what we experienced in Awarabong.
So I'm sure it was a bit of a shock.
Yeah, it was a huge shock.
What were the people like there?
People like there, I think Dr. Cho and Courtney were able to tell you, is that they were really enthusiastic. One of the biggest things was that they were so hopeful. The country is probably one of the more stable nations in Africa, and people there are well educated, and there are a lot of young people. So they really kind of want to help out and make sure that their future is better. So it's a good thing to be able to work with people like that.
Tell me, what were some of the kinds of things that you did there?
We were able to treat a lot of patients. We had a lot of people come in with malaria, and the area we're in, malaria is very endemic, and people get it, between 3 and 10 times a year. So, we would get a common cold, they get malaria, which is potentially deadly. So we were able to diagnose and treat a lot of them, as well as seeing more chronic conditions like arthritis, high blood pressure, things that we would also see in the U.S., but then there were, things that would be very different. And we saw lymphatic filariasis, which is another tropical disease that, we learn about in class, but you never expect to actually have a patient with it. So it was great to be able to get some experience with that kind of condition.
Were the people receptive to you treating them?
I think very much so. I know a lot of them were excited that, the white doctors, as they called us, were there to help them, and they knew that we wanted to, provide our expertise to help their community. And we had a huge turnout. Actually, the first day we were there, we treated, I think, 130 patients just during the daylight hours, and we had to turn people away because it gets dark at night and there's no electricity. So, they came back later in the weeks, but they were very receptive to having us in the community.
That's great. Now, Angana, do you think that this training will help you be a better doctor?
Yeah, I think definitely. I think NYCOM really does well to try to prepare us to see patients. We have a system where there are actors in place who act as patients, and we get to work with them to kind of learn about how it's going to be like in their clinical years as doctors. But nothing can really prepare you to actually see someone who has something wrong with them in terms of them being frightened about what's happening to them and what can happen to them in the future, and if anyone can help them. And I think that's probably one of the biggest things that we got out of going to Ghana. Beyond that, some of us are interested in doing public health, which are big concerns in the developing world. So to actually go to a developing country is probably one of the best things you can do.
Was there anything that you saw that shocked you?
Just the lack of preventive care or access to preventive care. So here in the States, people get to check their blood pressure often. They get to check their blood sugar and that kind of thing. You go to your doctor and you get a battery of tests done just to see if anything's wrong with you. But that's not really something that's done in developing countries where you don't have access to a physician.
Right. Now, you were there for a month, correct?
Yep.
Okay. How did you feel when you were leaving?
I think that was kind of the biggest shock to us, is we got so used to the lifestyle there and how friendly everyone is, and being here on Long Island, it's kind of different, and people don't greet you on the street, and we were really accustomed to being in the situation where we have less than we have here. So when we were getting ready to come back, we were excited that we got to sleep in comfortable beds and see our families, but I think we appreciated a lot of the friendship that we were able to develop there.
Well, that's great. Well, I want to thank you both. I will actually thank everyone for joining us today. And I want to wish you really the best of luck in your studies. And that's it for NYIT Roundtable. I'm Denise Moore. Thanks for watching.